Welcome to the HealthspanMD Podcast. Welcome to the Healthspan Podcast, where we talk about the science of longevity. You know, the most powerful tool we have, and if our goal is a long and vital life, is physical activity. You know, aerobic fitness, muscle mass, strength, mobility, balance, stability. These are critical factors I consider when I meet with a patient who cannot afford to leave healthy years on the table. But, you know, sometimes we identify those opportunities. I wouldn't even say sometimes. A lot of times we identify the opportunities for a patient to increase their health span with more directed physical activity. But that person has challenges. They're limited in their ability to be active either because of injuries or worries of getting injured. And, well, what do you do then? And these are important and really pivotal in the time that we have here, because time is muscle. You know, like that's a saying in neurology where they say time is brain, and the heart, we say time is muscle in regards to heart attacks. But really, you know, we're not here for very long. I saw a book the other day that was talking about longevity, and the title was 4,000 weeks, because that's how long the average lifespan is, 4,000 weeks, like shockingly short. And we can't afford to give away time delaying getting in shape, adding muscle if that's what we need, because that time goes so fast. But on the flip side of that, we also have to minimize the risk of injuries. Like, we cannot afford those setbacks. And if you are, wonder, well, why are we so worried about injuries, or why are you, doctor, so worried about injuries in your patients? Here's a study that just I can't get out of my mind. The title of this was Catastrophic Loss of Skeletal Muscle Mass in Older Adults Undergoing Total Hip Arthroplasty. So total hip arthroplasty is hip replacement. But this study did DEXA scans for body composition, and they were looking at muscle mass, and people, older adults, of course, undergoing a hip replacement surgery. And they did the DEXA on the day before their surgery, and then they repeated it 4 days later. So, they had their surgery, they, were pretty immobile for 4 days, and they just looked to say, well, how much muscle are you going to lose? And I would assume you'd lose a little bit of muscle, half pound or whatever. The study showed the average muscle loss in 4 days was 3.7 pounds, like 3.7 pounds of lean muscle mass in 4 days. So when you think about that, you really start thinking about the importance of avoiding injury and, avoiding hospitalizations as much as we can, of course, as well. But injuries are a big thing. So, I tell my patients, my trainers, my coaches, the first 3 rules of physical activity is no injuries, no injuries, no injuries. We can't have those setbacks. And that's where we need real expertise. Physical therapy expertise to guide us on how to be active, get the fountain of youth benefits of activity and be safe. And I have a real expert with us today, Dr. Matt Gloyd, who has a doctorate in physical therapy, owns an incredible physical therapy practice, PT3. And with Dr. Gloyd today, we're going to answer these 3 questions, among others. How do you get started or restarted on exercise in mid or later life in a safe way? Number 2, why is mobility, flexibility, and balance so important if your goal is health span? And then number 3, who needs a physical therapist in their life if their goal is longevity? So welcome to the Healthspan Podcast, Matt.
Thanks for having me. Really
I'm just thrilled to have you here. We met a couple of years ago. I have a really dear friend of mine, Connie Mariano, who we all know, one of the premier physicians, the White House doctor, of course. I said, I'm looking for a really high quality physical therapist to send my patients to. And she goes, I know the guy. Like, I got the guy. So I go in to see you. We chatted. You showed me a little bit about your things. And next thing I know, I was your patient as well. Tell me a little bit about your unique approach to physical therapy, what the work you're doing at PT3.
Yeah. So, what's unique about our practice is we're all about quality of care. And what we recognized 10 years ago getting this thing started, is basically if we can provide more time for our patients, make it more customized, we're going to be able to deliver the results they're looking for. And one of the unique things we do in our practice is we go to the homes. So we set up kind of a home model to give somebody that kind of more personalized care. But then we also have a hybrid model where we provide a private client center that are in different areas of town. So a client can transition to more of the high quality, high tech private rooms with your big TV, your music, but you really have a stretch cage, you have a fitness room, you have massage rooms, and it allows a physical therapist to provide a more elevated level of care because we have all this equipment. We have the time. We have a door that closes and you got just one-on-one PT with client. And what's also kind of cool about our practice is we blend the two worlds of personal training and physical therapy together. So, a lot of my older clients when I first started didn't know the difference between a physical therapist and a personal trainer. And I recognized that was something I wanted to capitalize on, which is, hey, we're a personal trainer with the lens of a doctor. And to your point about getting injured or avoiding injury, it's important to understand the human body before you go put them through a circuit training, fitness, weight loss program. And so what I think we offer that is unique is that we are PTs that can provide an open range of motion. We know what shoulder workouts are going to reduce the risk of re-injury, so you're safe when you go into that program to lose weight or to, kind of rebuild a better frame.
That's so valuable because I have patients who have a health scare. I just saw a patient actually today, and he has been focused on his business. That was his role as a father and a husband and a provider for his family. He grew his business. He did really well. And then he had a health scare. He had a thing that happened, and he's like, whoa, I need to start figuring this stuff out. And he had a DEXA scan, low muscle mass, high body fat. Like, that's a challenging combination. But he also, he as a businessman, he knows the value of paying to go faster. He's like, I want to work with an expert to go faster. But now I have access to people like you, and I can guide them. But there was a time when I was afraid to send any of my patients to a personal trainer because, let's be clear, like a lot of them have a different viewpoint. They're 22, 23 years old. They love being in the gym for 9 hours a day and, lifting, 6 plates and all those things. And I just, all the scare stories of people, that they got overworked, they got injured, or they hated it. And then they just quit. They just quit doing that. What you're doing is bringing that magic, that fountain of youth to people, but doing it in a safe way.
Right. And, I think there's an order of operations when somebody comes to you, whether referred by a doctor or they come in with, hey, I need to lose 30 pounds. The first impression that they have is they're going to just rapid fire, let's go hardcore circuit train. But what I think is real key to avoid injury and to position them for success is you want to make sure you work on mobility first. So if somebody comes in with severe back pain and they need to lose 30 pounds before they have a microdiscectomy or a lumbar fusion, the thought is, let's just go work them out. Well, the problem is they're in pain. So they're guarded, they're uncomfortable, they don't want to move. So my job, and I realized this a long time ago, that you need to loosen up their muscles, you need to open up their joints, and you need to position them where they don't have back pain anymore. Then the cool thing about that process is you get them so willing to move that they end up doing the dirty work for you as the therapist or as the trainer, and they just want to do the Monday, Wednesday, Friday workouts at home and be more independent because they feel good. But if it was the reverse and you tried to strengthen or work a fitness program with back pain, they're going to be non-compliant and they're going to re-injure themselves.
Your perspective on that was really eye-opening to me when I met you the first time, because I've had various injuries over the years. I've seen physical therapists, and the experience has always been positive. I love those people. They're great human beings. They really care. But I'd walk out with about 12 copies of exercises that I was supposed to do. Kind of remembered 3 of them maybe, and frankly, the reality is I do them a couple of times, and either I'd forget or I get better, and then I quit doing them again. And I realize that I'm wasting these opportunities that I have, and then when you completely different perspective when you're like, start talking about mobility and your process of getting that, patient set up for success. It just made so much sense to me.
Yeah. And you think about compliance. I mean, as physicians, as physical therapists, it's tough to get patients compliant on a home program. And I think that's the biggest problem physical therapists have today in a busy clinic is if you don't get somebody an outcome with that exercise, they're not likely to go home and do your 20 exercises. But if you can get somebody better in 15 to 20 minutes and show them an outcome that's dramatic, it's very encouraging. They're going to go home and do those 3 exercises that you proved worked. And that's kind of the strategy we've had at PT3 is we get compliance a lot faster because we generate the result that day, that first session.
Yeah.
And they end up believing in the system because they saw the result versus a busy clinic that can't get the result and therefore they're not going to do the exercise.
That's just brilliant. I really like to do a deep dive on how you came to this unique thing, but I know your past history with health, with doctors, all those things is quite interesting as well. Tell us a little bit more about where, how you've evolved in this and your own journey and how has it influenced the way that you deliver care.
Yeah, so I think my story is built around a few things, but my parents are both doctors working for the Indian Health Service, and we grew up with parents that were in the medical world. My brother is a physician here in Phoenix, is a family medicine doc, and so medicine is definitely part of our world. But what was kind of unique for me is that I had testicular cancer in the middle of PT school in 2009. It was a very extreme case. I went from dunking a basketball, I played football in college, and I was what I felt like was an alpha male. But then my number was called. I had severe groin pain. I ended up with back pain, and I pushed it along. And to find out that this was a real thing, a very scary situation. So that experience of going through and losing 35 pounds in a few weeks of chemotherapy and having not one strand of hair on my body, being pushed around in a wheelchair by my brothers, being very scrawny when just yesterday it seemed like I was, the specimen. So that was one of those things in the moment you don't appreciate. You're depressed, you're why me? But then when you come out of it, you learn so much about how to be a patient and how to treat a patient. So I think that's really shaped my personality and my approach as a physical therapist. Is I know what patients go through, and I know how deep depressed they can get in the moment. And really, what I think you appreciate more than anybody is exercise is a powerful pill. There's literature to support why exercise can, basically support risk for cardiovascular disease. It can help with obviously losing weight, but it can reduce depression, anxiety, a lot of great health benefits. But when I was going through it, I didn't realize if I would have had an exercise bike maybe right next to my bed when I was losing all my strength and, I was depressed, I could have just taken 2 steps, got on the bike, and even just pedaling would have been productive for my mindset, my, building endorphins to be more positive around my family members caring for me. And so that's one thing I would really tell people that are going through with whether it's chemo or they're going through a cardiovascular issue and they're sedentary for a while is just keep the pedals going, because that will influence your willingness to move again and to build back faster. The other thing that helped shape my the cancer experience helped shape me is when I went through that, I think I was just kind of average Joe. I'm happy to just kind of go through the motions, but coming out of that, you realize you lost a year of your life. And it was the blessing in disguise that, it sounds corny, but I was able to really turn my perspective around and say, I need a sense of urgency to do something different, to separate myself from other physical therapists. And it's not that I was competing, but to try to build something better than what's out there today. And that's where I think, PT3 being a concierge model, one of the pioneers to go into people's homes, but also on the wellness side of trying to get results faster so that the Medicare system will recognize that as a standard of care, and then we'll be able to offer this to people that can't afford it. Those are things that would not have happened had I not gone through my experience.
That's such an inspiring story, and I can absolutely see how that's influenced the way you deliver care because of you give hope to people that are in a part of life that they're not feeling a lot of hope. And we're going to talk about an example of a gentleman that was right there, and you changed his life, and I'm so grateful for that. But you're also right. Like the other thing that really resonated with me is I talk a lot about to my patients about the vicious cycle and the virtuous cycle. That people can get behind on certain things. They have a health challenge. They're in the hospital. They lose strength. They get depressed, and then they start eating poorly, and then that leads them not sleeping well, and then maybe they're drinking more, and then all of those things. That's the vicious cycle. We need to turn that around and give them that virtuous cycle. And it's people like you that give them that hope to start seeing those little moments of brightness to say, okay, I can make it through here. So you facing the challenges you faced allowed you to be a great guide for people in their greatest time of greatest need. Like, that's beautiful. And how many times in life our biggest challenge ended up being our biggest opportunities, and you did that. So that's kudos to you. That's just so cool. So let's go. When I led off the podcast, I was talking about people, later in life. Maybe been athletes, maybe never been in a gym, but all of a sudden they're like, you know what, this is important. I need to add muscle mass. I need to get more fit. I need to get my blood pressure down. I need to reverse my diabetes. And as you said, I don't know if there's a more powerful tool that we have for health and quality of life than physical activity. Like, if there is one, of course, everybody's unique. Some people need to sleep better. Some people need to manage stress better. Everybody needs to be active, though. Like, if they're not doing that, it's just really challenging to achieve those goals. But somebody that's wanting to do that and they're just lost, they're apprehensive. I don't want to get injured. I remember, my brother-in-law, he started running and he tore his Achilles and he never walked again. Whatever those things are. What advice do you have to somebody who's concerned about their injury risks? They're not sure how to go. How do they get started in the right way, in a safe way to being active?
Yeah, it goes back to order of operations. I think anybody that's trying to, get in better shape or build a better profile for themselves, and, they're motivated to do it, the first step has to be, make sure you have full range of motion, make sure you have full mobility, because if you're stiff and you go out and perform, let's say you go hike the Grand Canyon, you might feel good during the process and feel motivated, but the next morning when you wake up, do you feel like jumping up for joy? No, you feel like you got in a car accident because your muscles have adaptively shortened so much that you can't move. So my big point is, make sure your flexibility, make sure your mobility is optimal, whether that means you go to yoga, whether it means you go to a physical therapist first to get assessed, or a personal trainer that really is heavy in wellness. Get assessed that, do I have full range? Do I have adequate mobility so that when I go and do this high intensity performance program, I am going to reduce risk for injury. And two, the double bonus is you're actually going to perform better and you're going to want to continue that process. Versus when you feel real sore the next day, you're like, I don't think I'm going to get out of bed today. I'll push it to tomorrow. It really works out in a twofold fashion where you're avoiding injury, but you feel so good that you want to continue and perform better. That is my number one recommendation, is mobility first, just so you provide an insurance policy for yourself.
That's, that's actually brilliant. Like because a lot of people, they're ambitious, right? They go all out. All right, well, I'm going to spend an hour and a half in the gym, and I'm going to lift all the weights, and I'm going to, do all of these things. And as you said, injury risk, they hate it, they feel miserable afterwards, and then they're done, and they don't. You're easing people into this so that they can start, adapting. You're setting them up for success in this. I think that makes a ton of sense. We talk to our people that have not been aerobically active. Like, okay, we're not starting with CrossFit. We're not starting with HIIT. We're starting with let's just walk, right? Or maybe zone 2 training, like doing that low, moderate level of activity just to start building that base of the pyramid so that then they can reach for those heights down the road. That's what you're doing with this, is you're building that base of a pyramid in regards to their musculoskeletal system. Is
right.
that yeah.
Right? And then low dose exercise, making sure you don't just go nuts and try to hike the Grand Canyon in one day. You start with a low dose, slower exercises that are more controlled, because you actually, same thing, lower the risk, but you also increase the productivity of that exercise. So when you go slower, you're actually working harder because you have to co-contract muscles at the same time, which means you're generating more heat. Your heart rate has to go up to pump more blood to all the different tissues. So another strategy is slower, more controlled exercises are safer and they're more productive, and you can still operate in a circuit training fashion, but when you're actually performing the exercise, going faster is not always better, because you're actually increasing risk and you're decreasing the productivity because you're probably going through momentum versus actually working to co-contract connective tissue.
All right,
so that's another tip.
I got a confession to make. I hear what you're saying, and I hate stretching and I hate doing core exercises, and it's because I don't see the immediate benefit. Like if I lift weights, I can see the outcome. If I'm aerobically active, I kind of get that immediate benefit of stress reduction, all that, but I'm getting more fit. Whereas the flexibility things is so hard to see the results. How do you keep people on track with that? Like how do you help people see that benefit?
Yeah. And nobody wants to stretch at home. I mean, I would like to say one of the gurus around vibration stretching, and yet I don't stretch as much as I probably should. But I'll tell you what, if you can go to a person who can provide that mobility and do it fast and get you margin on your mobility, then you don't have to do as much. You can do just 5 to 10 minutes in the morning to maintain the range that somebody else bought you. But then you go nuts on your exercise. That's kind of the strategy where you don't really have to go through that monotonous stretching. But a guy like me or a group like PT3, we can actually coach you on how to be more effective with your stretching so you don't feel like you're burning all this time doing things that we don't want to do, which is boring. But if you see a result and you feel better immediately, why not?
Oh, and you definitely showed me that as well. Like, it showed me in a limited amount of time, 45 minutes or whatever it was, how much more flexible and I was, and seeing that was a real eye opener to me. So I personally can attest to the magic of what you're doing there. I also want to think about this more in the lines of maintenance, because when we're talking about longevity, I'm focused on preventing heart disease and dementia and cancer, and we have effective tools for doing that. But the reality is that orthopedic issues are just really common as we get older. And as one orthopedic surgeon told me, a little cynical maybe, but funny, he says, yeah, all you longevity guys, yeah, you're great for my practice because these people are going to live long enough to just be a wrinkled bag of worn out joints in the end. He has a valid point in that, though, as well. I mean, as far as I know, regenerating cartilage is, I don't think we're doing that. Maybe the stem cell people are figured that out. I don't know. But how do you see your role in your patients in an ongoing, like your high-end people, they're really all in on longevity. They have great lives and they want to stick with it. How are you helping them do that? And what is the framework that you're using to help them with that?
Yeah, so let me set the stage for this answer. The framework is, 70% of my clients are executives that, are between 60 and 85 years old. We have a few, 95-year-olds, but they're kind of the exception. But if you think about this age group and you think about somebody who's built a business, sold a business, and now they have more money than they can handle, all they really want in life, their quality of life is built around, I want to play golf as much as I want. I want to play pickleball. And I've been sitting in a desk my whole life, and now my body hurts. I'm overweight. So what's cool about that is you can almost predict what their problem is. And I'm going to say one word, it's stiffness. So a lot of these people have back pain, knee pain, hip pain, foot pain, and they've been through surgeries at that age. They've been through injuries. They've been sitting more than they ever have in their entire life. And so one thing that I realized that everybody's adaptively shortening and getting more stiff. So if their pain is on the side that's more stiff than the side that isn't stiff, it doesn't hurt, we have the formula to getting them better, and that's opening the door, loosening up muscles. And so I've been able to build a protocol with technology and equipment that can get people more range faster, which reduces their pain, gets them to go work out more, and gets them to go play golf more. So it's pretty cool when you can just take this population that makes up 70% of our practice, and we have the answer to every one of them without looking at any MRI, X-ray, because the formula is they're more stiff than they ever were before. When you have an injury, you don't come out of that injury more mobile. When you have a surgery and they cut on you, you don't, after 2 weeks of being cut on, you're not jumping up for joy. You're more adaptively shorter, you have more scar tissue, more connective tissue. When you are sedentary, you sit more, so you're in a 90-degree hip flex position. Your hip flexor isn't more mobile, it's actually more stiff. So I really feel like I've mastered the problem that we need to solve with these executives at gated communities north of the 101, Desert Mountain, Whisper Rock, is they're all stiff. So let's not overcomplicate it. Let's mobilize them. Let's loosen them up. Let's do it fast so we can get them to see that they can do something they couldn't do just 20 minutes before. And then they're loyal fans of yours, and they will execute any plan you put in front of them because they saw that it worked, that your formula worked, and that you were able to achieve the goals that gets them to play golf, take money from their buddy on the golf course, which is all they care about.
Yeah. Isn't that the truth? I play golf as well, or I don't know if you can call what I do playing golf really, but there's something about the sport that is addictive. Like, I don't know what it is. And I could see where that might be my future life as well. When I met you, it just totally made sense to me, and I ended up being your patient as well. But I also had a patient who I just met, and he was in really bad shape. Like, he was afraid for his future. I was afraid for his future as well. And he's actually been a podcast guest, so I'm not telling any stories on him. But the good doctor was really sick during COVID, when COVID was a very serious problem. Ended up in the Mayo ICU for 22 days. I can only imagine what his muscle mass loss was during that time. He went into that healthy guy, a little overweight, came out of it, and he couldn't even stand up without assistance. I meet him and I'm like, okay, I can work on your nutrition stuff. We'll optimize your blood pressure and the cholesterol and the blood sugar and all these things. But dude, you got to move. Like, we got to figure out a way to do this. And he's all in. Like, he wants to do that, but he can't. Like, he just says, I'm so limited in what I'm doing. I'm not sure where to start. And I said, I know a guy, and I sent him to you. And tell us about that experience. Like, what you did with the good doctor there.
Yeah, and it kind of ties into some of the conversations we've already had, where client comes in, he's referred, wants to lose weight, wants to get his life back on track because he had a medical scare, very life-threatening, very serious, and it rattled him to the point where he said, now's the time. I'm going to do it. I'm going to do whatever it takes to get in better shape. And so again, first step was, hey, let's assess how much mobility you have, because it sounds like you have back pain, knee pain, hip pain, foot pain. And we got to get over those hurdles first before I just throw you on a elliptical or treadmill or circuit training. So we got him more mobile. We reduced his pain, did it in just a couple sessions where he became a raving fan of what I was doing. So then he said, whatever you tell me to do, I will do. And basically what was really special about this experience is that he actually did more for himself than I actually, as a personal trainer with the lens of a doctor, did for him, because he felt so good that he went out and created a home program that had some instruction, some guidance for me, but he executed it Monday through Friday. And then I was basically his, hey, you're probably going to get a little stiff as you go through this with delayed onset muscle soreness, adaptive shortening, because you haven't moved like this in a while. So we'll put my time into keeping you mobile, keeping you functional so you can continue to rev up the engine. And it worked perfectly. I mean, I basically provided mobility for 75% of our sessions. Then I would also give him a little bit of a personal training circuit where I would kind of give him a little more flavor, more creativity around his workouts. And then we'd progress what he does at home to the point where he became so independent at home that he was doing the work, making me look good. But his life's changed. And as you know, when people lose weight and they go on these dramatic programs, 6 months later, they're morbidly obese again because they didn't actually change their habits or they didn't restructure their behaviors. They just went through an aggressive program, went back to what they were doing 6 months later. This patient, this client, 3 years later, it looks better than he did when he was with me, which shows you that he did it the right way. He got the mobility first. He bought into the system. He knew how to, if he did get stiff or sore, what he would do to recover from that. And he just hit the ground running and never looked back, because it's like cigarette smoking. When you finally break through and you no longer smoke cigarettes, the last thing you want to do is go back and smoke a cigarette and fall down that path again. So it was pretty special, and I appreciate you sending him my way.
No, it was special for me as well. And, I a little follow-up, some of this some of this you may not, but, I saw him ongoing throughout this, but I saw him a year later. He had gone on a trip to Hawaii pretty soon after he had been sick, and he was recovered enough to travel, but he had to go through the airports in a wheelchair, and he couldn't take his luggage, all those things. A year later, he and his wife says he's zipping through the airport with carrying his luggage, throwing it up in the bin, all those things. And that was so meaningful to him. Here's something you probably don't know. We did a DEXA scan on him not too long. Like it wasn't right after he got out of the hospital, but within a couple of months of him getting out of the hospital, just a DEXA for body composition. And 8 months later, after he'd been working with you and things, he's feeling great. His labs are like completely different. He really reversed, almost diabetes. His blood pressure, cholesterol are amazing. But he was not disappointed, but he says, look, I feel great, but I've only lost 10 pounds. Like I wish I would, that was a bigger number. And we ended up doing a repeat DEXA 8 months later, 71 years of age. He had lost 10 pounds. Yes. But the DEXA showed he lost 16 pounds of fat and gained 6 pounds of muscle in 8 months. Like, that is crazy. Now, admittedly, he was really deconditioned. Not a lot of 71-year-olds are going to add 6 pounds of muscle in 8 months. But this, those ideas out there that you can't add muscle after a certain age, wrong. That you can't lose fat and gain muscle at the same time, wrong. But it's you have to do it the right way. And a little bit of a tangent here. That's why I'm really concerned about the way that the Ozempic, the Mounjaro is being used in the community. We have research studies that show that 40% of the weight loss of these medications is muscle loss at a year. Like, think about that. You lose 30 pounds and 12 of those were muscle. Are you in better health Like you might be skinnier. And I can imagine the scenario where people, they're blasting away with the Ozempic. They're losing that weight, and it's addictive to see that scale going down, right? They're losing all their muscle, but then it's not, they don't want to stay on it for because it's $1,000 a month or because side effects or whatever. They stop it, and it's the second thing we know about Ozempic. You stop it, you're going to regain the weight. But what are you going to gain? You're not going to gain muscle, right? So can you imagine what's going to happen to people that are going through those Ozempic cycles? They're blasting away with Ozempic. They lose 25 pounds in 4 or 5, 6 months, and then they stop the medicine. They regain the weight, but they've lost muscle. Now they're adding fat on top of that, and then you just keep going through that cycle. Like, it scares me to death. It scares me to death. And these medicines are really powerful tools. Like, I use them in my practice, but I use them very thoughtfully in the setting where we're focusing on their nutrition, their protein intake, and their physical activity. And that's the things that you're adding to that, equation as well. Because you're exactly right. It's losing the weight. Okay. Keeping the weight off. It has to be about habits as well.
Yeah. Exercise is the best pill. Ozempic, the challenge with that is once you get off it, you think you need that pill to get you back into shape, and you've no longer built that reinforcement around exercising to do it or eating better. And so you've kind of enabled yourself to rely on a pill. I'd rather that pill be exercise. We've talked about all the time is breakfast, lunch, and dinner. We're programmed to eat. But if we were programmed to exercise for 10 minutes 3 times a day, how much better would our community be in the public health world would excel, because we have people that are off medications. They'd have less risk for injury, and the benefits are remarkable. I'm not going to ask you to be an orthopedic surgeon here, but just about everybody with enough age has, back, hip, shoulder, knee injuries. And, sometimes, no doubt about it, surgery is needed. But as I see this as a non-expert, when I see randomized trials of arthroscopic surgery versus physical therapy for knee issues, or sometimes for back surgeries versus physical therapy, it seems to me like the outcomes are the same. Is there a role for physical therapy before surgery for a lot of people? 100%. I have a good friend, doctor, who does total hips, total knees, and he and I are obsessing over this. If everybody got prehab and they saw a physical therapist that would focus on mobility, they would all have better outcomes. The surgeon would look like a superstar no matter what he was doing, because if you think about the process of physical therapy and why it's so challenging after a total knee replacement, which it seems like 50% of Desert Mountain, the community has them. All we're trying to do is get range of motion for that knee. That's it. We're not trying to get them stronger. We're not trying to do all that. They already had a lot of that to begin with. The real secret behind rehab or prehab is if we can get the range of motion around that patella, that knee, to allow it to bend. And if you outsmart the process by getting it before surgery, you know what happens? They avoid the surgery. Yeah. Or if they're that bone on bone where they don't have any cartilage, they hit the ground running because they got everything they needed before surgery, where now the rehab is so much easier, less invasive, and more productive, and now they're back to golf in 6 weeks versus, 6 years. I mean, some people. So I'm really a big fan of, if insurance covered it, we'd all be doing it, but they don't. So you have to go to a private PT group like mine to get that kind of mobility before surgery to, one, try to avoid it, and two, if you don't, you hit the ground running, put yourself in position to succeed, so you then have a better outcome, and you're very thankful. And you know who gets the credit? Not the PT, the surgeon, because nobody goes back on the golf course when they're 65 and they had a knee surgery, and they say, when somebody's doing a deep squat or hitting 300-yard drive, somebody says, "Who did your knee?" Yeah. And it's the surgeon that gets the credit, which I totally appreciate. But if I was a total knee, total hip surgeon, I would pair with somebody like our group to then provide them better outcomes. And I would love to see the data over time on that, because I can assure you that they would still be okay being able to provide, a high number of surgeries, but they would know that their client had a better outcome and they're set for life.
Yeah, maybe I will wrap up with this, and a little bit of my pet peeve, I guess, in this is that insurance is just not aligned with the best interest of the patients. On one side we have patients who want the best outcomes, of course, and then we have over here providers like yourself, us, lots of they want to deliver that really great care, but it's the things in the middle that don't align with that, like in insurance sometimes. And in this case, I guess I'm coming to this conclusion, and I think a lot of people are, is that if you want the best quality, you're likely going to have to get outside of an insurance practice. Like the insurance practice is I have an insurance practice. I take insurance in my practice, but we also have other, services that we're providing that kind of whole person approach. But my colleagues who just take insurance practice, they got to see 40 patients a day. There's no way you're delivering quality care. I think it's as bad or worse than physical therapy, right? Like if you have a straight insurance-based practice, your margins are tiny. You got to cram people in, and you don't get enough time with them. I've also heard that from physical therapists. They're like, we're making great progress, but the insurance only paid for a certain number of sessions, and now they're over. But give me your thoughts about this. I mean, you've made that realization, I guess. You've already said, look, to deliver the care I need to deliver, it's going to be in a concierge model, and you've made that work really well. But I'm sure you hear the tales of woe from your colleagues.
Yeah, this could be a whole podcast on
insurance, I know.
But I'll shorten it up and make it somewhat sweet here. But the challenge with the insurance model is it's not the people to me. The physicians, the physical therapists are all motivated to get people better. They love getting people better faster. So I never blame the people. But the problem with the model, if I'm the PT in an insurance model and I see 5 patients, I'm going to do better work on those 5 patients because I have more time to spend. I have more critical thinking ability. When I see 30 patients an hour, or 30 patients a day, I'm really 4 or 5 an hour. I'm now juggling so much that I can be really good at managing that room, but I'm not really getting those patients what they're looking for. And the other problem is you're getting paid as a physical therapist the same amount whether you see 5 or 30. So we would all prefer to see 5, but the business wouldn't run efficiently if you only saw 5. And so the model is really, to me, failing the physical therapist and the patient because it's not promoting outcomes. In my world, the reason why I jumped into a private model is I realized that I could see less people deliver better results and get paid more, which is the reward of doing good work. And I could scale that and turn a low volume, high quality model into a eventually high volume, high quality, but it takes time. You got to grab great people that are thinking the same. They look the same. They all want better care for their people, and they just need more time, more resources, and I provide that with my practice. And everybody who's ever worked for me has left the insurance model and realized they would never turn back because we've checked every single box. The only box we may not check might be a little structure because we're very dynamic, but every box is checked other than that on quality of care, quality of life for our professionals and for our patients.
Yeah, that's so well stated. Matt, I'm really grateful for you to be here. I'm grateful for the great work that you do with my patients and with me as well. And I know there's going to be a lot of people that hear this and say, I need to see this PT3 place. I need to know more about Matt Gloyd. How do they learn more about you and how to potentially come see you in your practice? Yeah,
so our website is pt3az.com, but if you really want to kind of see what we're doing, you can go to Instagram, look up Matt Gloyd DPT. You could look up PT3 concierge or even targeted vibration therapy, which is our new business model around mobility. So it's really cool. We have a TVT stretch center up north by Desert Mountain. We have a lot of really cool things going on that are really trying to get cutting edge on wellness, mobility outcomes. And, we're in network with wonderful doctors like Dr. Todd. And, I just think we're all blessed to be in a world where we can provide better care for our clients.
Yeah, well, it's certainly a blessing for me and my patients to have you available to us. Matt, thank you so much for being with us.
Appreciate it.
All content created by me and HealthspanMD is for general informational purposes only and is not the practice of medicine. No doctor-patient relationship is formed. The use of this information is at the user's own risk and is not a substitute for professional medical advice, diagnosis, or treatment. Hi, I'm Dr. Hurst. We created HealthspanMD for people who are dissatisfied with healthcare. Common complaints about healthcare include difficult access, poor communication, rushed appointments, disease-focused or sick care with little interest in helping people get or stay healthy, and little to offer beyond a prescription or procedure for optimizing health. This type of healthcare is unacceptable, but most aren't aware that they don't have to accept low-quality healthcare. HealthspanMD provides exceptional medical care. That means appointments when you need them, time to talk to your doctor, get your questions answered, understand your problems, and get a clear plan to achieving your health goals. But it also means a comprehensive, proactive approach to your health that goes beyond prescriptions and procedures. As a HealthspanMD patient, you will get our expert, physician-led team of doctors, health coaches, dietitians, exercise specialists, mental health, and other health professionals to help you take advantage of your best opportunities to prevent, treat, and even reverse disease. And you may be eligible to have our care model reimbursed by Medicare and some commercial insurance. If you're no longer willing to settle for low-quality health care, schedule an appointment at HealthspanMD to experience health care as it should be.